Hi everybody, Dr. Daniel, and today I'm talking about an older NSAID drug that's been remade as an acute therapy treatment for migraine and approved by the FDA. The drug name is Elyxyb migraine. It's kind of hard word to say. I'm going to spell it Elyxyb. And what it really is an old NSAID called Elyxyb, which has been out as a tablet form for a long period of time. So, migraine is a genetic familial neurologic problem affecting 25% of women and 6% of men. Prevalence of migraine is a female to male ratio of 3 to 1, and migraine is the sixth cause of disability worldwide. It causes unexpected visits to the emergency room. Although recent developments have brought a number of effective new medications for treatment, sadly, 70% of persons with migraine do not receive proper treatment. 50% of persons affected do not go or no longer go to the doctor, preferring to self-medicate with over-the-counter oils, compresses, or medication. So there's a need for a quick, safe treatment for migraine that can be taken anytime during a course or attack of migraine. So, Elyxyb is an NSAID for acute migraine treatment that is delivered in an oral solution. It works within an hour, and it works even for moderate to severe migraine. And it works to treat migraine regardless of when you take it. Sustained relief occurred for up to 24 hours in persons taking the drug, and the treatment was well tolerated with no serious adverse events reported in clinical trials. So what's the indication for Elyxyb use? Well, it's indicated by the FDA for acute treatment of migraine with or without aura. How's it given? It's supplied as an oral solution containing 25 milligrams of Elyxyb per milliliter, or 120 milligrams / 4.8 milliliters. It's in disposable glass bottles, and it comes as a self-microemulsifying drug delivery system that improves solubility and bioavailability for fast absorption. And the maximum dosage in a 24-hour period is one treatment, which is 120 milligrams. Well, how quickly does this drug work? Following administration of 120 milligrams of Elyxyb under fasting conditions, the median time to peak concentration, that is the Tmax, was observed to be 1 hour. Well, what did the drug studies show about this? FDA approval came after analysis of data from 2 double-blind, placebo-controlled trials of patients with episodic migraine. Well, those are folks having 2 to 8 migraine attacks per month with no more than 14 headache days per month, and with 48 hours of headache-free time between migraine attacks. So they didn't really have chronic migraine. Results from both studies showed a significantly greater portion of patients treated with Elyxyb achieved pain freedom and symptom freedom at 2 hours post-dose compared with those treated with placebo. What were the adverse reactions? Well, the most common adverse reaction reported was dysgeusia, means things taste bad. But like other NSAIDs, it carries a boxed warning related to risk of serious cardiovascular and GI adverse events. Possible drug reactions can occur with certain substrates and inhibitors. That's on my blog report. What are possible effects of pregnancy and breastfeeding? Well, weigh risk-benefit in the first trimester, the FDA says. Consider avoiding use at 20 to 29 weeks of gestation and avoid using starting at 30 weeks of pregnancy. For individuals desiring pregnancies, NSAIDs may delay ovulation. It's something that's been reported. But it can be used during breastfeeding. Is there a risk of causing medication-overuse headache? Well, you better believe it. Elyxyb is an NSAID, and those drugs, if you take one of them 15 days a month, in certain persons can cause medication-overuse headache. So it shouldn't be taken more than 2 days a week. So at the end of my comments on this drug, I hope it works for you. Be sure to seek it out. Go see a neurologist and get on medication, all you migraine patients, and I'll see you again on the next talk.